Good afternoon, everyone. Welcome to our webinar on Return to Practice. We're so delighted to be joined by so many of you this afternoon. My name's Naomi McVeigh. I'm Regional Head of Allied Health Professions for Health Education England in the Northwest. Hopefully lots of you have had a chance to pop onto menti.com and answer the first set of questions. If you haven't, do have a go now, and there'll be a further opportunity to in a couple of minutes. Next slide, please, Megan. So we're delighted to be focusing on return to practice, supporting AHP workforce supply across systems in England. If you'd like to share any insights and comments from today, we'll also be tweeting using the hashtag #IamReadyToReturn. Next slide, please, Megan. So what we're covering today, this is really around maximising return to practice by NHS trusts and systems and others to support local workforce priorities. So over the course of the next hour and a half, we're going to provide an update on current HCPC return to practice guidance. We're going to focus on the success of HE's return to practice programme and the ongoing support offer. We're going to think about what effective return to practice by NHS trusts and systems looks like, and we've got two great examples from providers to help illustrate that. And fundamentally also we're going to be making sure that the experience of returnees is at the heart of organisational and system approaches, and have a panel of returnees with us as part of the speaker session. Next slide, thank you. So this is the agenda. We're starting we're starting with Natalie, who's our interim national return to practice lead here at HE, followed by Paul Chapman, who's the national programme manager for AHP programmes, and Paul's going to give us an update on the national RTP programmes. Then we have Jane and Debbie, who are going to give us examples from the trusts on the agenda. And as I said earlier, we're going to have our panel of returnees speaking to us through a Q&A session. And before we close, we'll give you some next steps to go away and think about in terms of taking forward return to practice within your organisations and systems. Next slide. So just a quick reminder, if you haven't had a chance to post your responses on menti.com, you should just be able to pop it into your browser, enter the access code and give your responses, and we'll be coming back to Menti at the end of the session. So without further ado, I'm going to hand you over to my colleague Natalie, who's going to give you an update on the HCPC guidance. Thanks, Natalie.
Thank you, Naomi. Okay, hopefully everybody can hear me, and I'll make a start. So my name is Natalie Matchett, as Naomi's mentioned, and I'm currently working as the AHP Practice Learning Manager at Derby and Burton Hospitals, and as a repair HE fellow at the moment, looking at recruitment and retention, sorry. But as Naomi's mentioned, I'm going to be covering Natasha's post as the interim National Return to Practice Programme Manager for the HCPC registrants, and I'm officially starting in just under a few weeks' time. So I'm absolutely delighted to be here to talk to you today to give you an overview about HE's programme that is run to support our AHPs, healthcare scientists and practicing psychologists that are returning to practice by supporting them to return to the HCPC register. And it's the HCPC return to practice requirements that I'm going to focus on today. So if I could have the next slide, please. So you can see here are the return to practice requirements, and the National Return to Practice programme has been designed to provide the opportunity for returnees to update their skills and knowledge in their chosen profession and within the scope of practice. And we can offer clinical, financial and academic support to support the returnees to meet this minimum criteria to return to practice, and therefore to meet the minimum requirements of the HCPC register. So our programme aims to assist the returnees by following the below HCPC return to practice guidance, which you can see there. So if someone is up to 2 years out of practice, there is no requirements. So there's no element of updating, then they can just apply to the register. If they're 2 to 5 years out of practice, it's 30 days of updating, and 5 years or more, 60 days of updating. And you can see there that 1 day is equal to 7 hours. And I'm going to talk a little bit more later about what updating entails. If I could have the next slide, please. I'm just going to add here at this point that there is also a HCPC temporary register, which is different, and is the COVID-19 temporary register of all formal registrants who have deregistered in the past 3 years, and they've automatically gone on there. And that's for those that want to offer their support during the pandemic. But this registration is temporary and they're reviewing this all the time. But just to note that they still have to meet the HCPC's return to practice standards, as you've just seen. So for those that, for instance, are 2.5 years out of practice and they want to carry on practicing once the temporary register is closed, they need to continue with the returning to practice process to achieve permanent registration with HCPC. But the great thing is that they can use their hours that they've gained on the temporary register during supervised practice towards re-registration. So that's great. And the next slide, please. Carrying on to highlight just a few of the other changes by the HCPC, which is welcome news because they have allowed for more flexibility for returnees during the pandemic. And as you can see here, I've highlighted those as they've changed the time scale, so within which applicants can complete their return to practice. And that's temporary change from 12 months, and it's now gone to 24 months. And then the other things they've changed, the next 2 points, the evidence that they accept as proof of supervised practice, which is normally completed in a clinical environment, for instance, and for formal study, so sort of certified courses. The great news is that they've allowed simulation as an accepted means of updating their skills and knowledge for both of these. And the general guidance given by the HCPC is that if simulated learning is taken place as part of supervised practice or as a certified course, then they can use that towards their hours. And again, I think that's really helpful at the moment for organisations and returnees during the pandemic to look at alternative ways to get their supervised practice, whether that's virtual placements or any sort of technology enhanced learning. And the next slide, please. So looking at the routes, there is a variety of options to suit individual learning needs when it comes to how returnees want to update their knowledge and skills, which I'll talk about in a moment. But it is really flexible and it is decided by the returnee, which moves me on to my next bullet point, to really stress that it is managed and self-managed by the returnee, and they can create their own plan of what skills and knowledge that they need to update on. It needs to be identified by the returnee, and it's up to them how they intend to achieve this updating. So it really is their journey. It really is led by them. But I think the flexibility actually is now in our favour, particularly with the COVID-19 added challenges. The HCPC does have a process, which is what we're talking about now, but it is guidance and it is arm's length. The competency as well of returnees is assessed by the HCPC, so not the organisation or the supervisors. And it's down to the returnee to collect and submit the evidence and the hours and to apply back onto the register with the HCPC. And as we've mentioned, the temporary change, they've got 24 months now to do that. And the next slide, please. So what does updating entail? So the HCPC does advise on what the updating activities can be a mix of. And you can see here there's private study, formal study and supervised practice. And just a little note there that no more than 50% of the total hours can be made up with private study. But they have got a choice of supervised practice, and you can see there that that's practicing with someone under the supervision of a registered professional from their same profession. And formal study, a period of structured study, which is often provided, for instance, by a person or an organisation such as distance learning. And then private study, a period of study which is structured by the returnees themselves. So perhaps looking at websites, some books and journals and reflecting on that. Do remember, as we've said, simulation is now covered under both of those, and you can see an example in the box in the below right hand corner about how that might look in terms of how they can mix topics, the different ways to update to suit their learning styles. And it really is down to the returnee to know what their gaps are in their knowledge and skills and choose any of the above that are relevant to their development needs. And the next slide, please. And we've also got funding available, and you can see there we've got a total of 1,300, and that's split down into £300 that's available for 4 more courses for the returnees, and then there's £1,000 that can be claimed by any of the supporting organisations that provide the supervised hours, and that's split down again for £500 for that supporting organisation to help towards contracts, honorary contracts, DBS, and things like that, and then £500 as well for the returnee themselves to help towards any sort of out-of-pocket expenses. There are some universities in England, just to point out, that do run specific return to practice courses, but they are limited and they're not validated or endorsed by HE or HCPC. It's just to really get across so that funding really shouldn't be a barrier, and please do get in touch if there's any queries regarding that with us. And the next slide, please. And this next one here, you can see the inclusion and exclusion criteria for the programme. And on the left-hand side, you can see there that it's for any profession, qualified AHP, healthcare science or practicing psychologists living in England who want to return to the register and then go on to work within health, education or the social care sectors. It's for those previously registered with HCPC. It's for those that have been qualified in the UK, but that have not registered with the HCPC in the last 5 years. And it's also for those that have already registered with the HCPC, but they need a period of clinical updating because they've not practiced for the last 2 years. And on the right hand side, you can see there that the programme is not currently open to the same professions of those AHPs, healthcare scientists and practicing psychologists who have qualified abroad and who haven't ever been registered with the HCPC. And they can be then pointed towards the HCPC overseas guidance there. It's not open at the moment for returnees looking to work outside of England once they've returned back to the register, and it excludes any individual that has got a fitness to practice issue. And unfortunately at the moment we're not supporting biomedical scientists that need to update to meet their certificate of competency. So they have a period of training that they need to complete before they get their certificate of competency, and at the moment the programme is unable to support training posts. It is something we're looking into. And the next slide, please. So why should returnees join our programme and what's in it for them? They've got access to support and guidance from myself and the team, support in finding a supervised practice placement so we can help signpost with the contacts that we've got, access to e-learning modules and e-learning for health, so even for those that haven't got an NHS email, we can help there. They have access to a closed Facebook page, which Paul will talk a little bit more about, for past and present returnees. And that's really a great source of peer support and information for them to share on the return to practice process. Funding, as we've mentioned, and then it allows us as well to report on numbers of the HCPC registrants returning to the register. And the next slide, please. And what are the aims of the programme? So we've already mentioned it's to support returnees to return to the HCPC register using the HCPC guidance and help facilitate supervised practice. But I think more importantly for organisations to understand the benefits of supporting returnees. And I know Paul and then Jane and Debbie are practice placement partners, and our returnees themselves will go into some examples later on that. But we're also aiming to support yourselves regionally and via STPs and AHP councils for their workforce plans to include return to practice on the agendas as a way to support recruitment and retention. We're also working hard to engage with the HCPC, also our professional bodies, and we've been doing a lot of work with them lately, our HIs and professional leads to promote and collaborate on return to practice. And also we're aiming to share return to practice learning and examples of best practice across the whole of the health, social care, education and charity sectors. And the last point there, return to practice is a national deliverable under the NHS People Plan to meet national workforce plans. And we do have targets for the numbers of AHPs returning. But I think for us at the moment, it gives us all a real opportunity to challenge the status quo. It gives us that mandate to build a shared purpose for return to practice and to experiment perhaps with new ways of working with returnees and to really put return to practice at the front of centre of everything that we do. And that's where we need your help, which is the next slide, please. Yes, we need your help to get the message out there, but also to dispel any misconceptions. So I've put here just a few of those to do a bit of myth busting. Return to practice can include any paid employment, and that includes those in a support worker role or volunteering, and they can count towards their hours of supervised practice, as long as they're with a member of their own profession. They don't need to take exams. They're not there here to retrain. They hold a qualification. And returning to practice is really about gaining that registration for the HCPC to use a protected title. And yes, they can see patients. So you can see there on the right hand side a recent example only 3 days ago on our closed Facebook page, and I've been given permission to use it from one of our returnees. And they're there, and you can see there where the arrow's pointing, and they're just struggling with trying to gain some supervised practice within an organisation, because they thought, or the organisation thought, that because they wasn't registered, they then can't see patients. And I think there's often a misunderstanding here about what level of support is required. They're not students. Return to practice is an opportunity to refresh. They're not about starting from scratch. And often they have honorary contracts and they're supernumeracy, and they're under the supervision of a qualified member of staff, which means they've got the necessary insurance and they can see patients. And I think, you know, they're an untapped resource, and they really have so much skills and experience that they can bring to our patients. And again, hopefully Jane and Debbie and the returnees themselves can expand a little bit further on that. And the next slide, please. So to finish, to surmise how you can help us with the programme. So please do engage with us and engage regionally about the benefits of the return to practice, and help us get that out there, particularly in helping with recruitment and retention, and engaging with the return to practice leads and myself. Email me if you've got any contacts that you're aware of for supervised practice within your region, because we've got a growing list that we can share with our attorneys that's really helpful. And really try and encourage placement providers to consider hosting a returnee. And of course, you can always signpost to our webpage for any further information or inquiries, which is on our next slide. And the last one, please. So you can see here, my contacts are as follows. So thank you so much for listening. I hope to hear from you, and I'm happy to help in any way I can when I come into post shortly. I look forward to learning and working with you all. And without further ado, I'll be introducing you to the next speaker, and that's Paul Chapman from HEE, and he's our National Programme Manager for AHP programmes. Thank you.
Good afternoon, everybody, and thank you for coming. Thank you for listening, and thank you, Natalie, who, as you'll be aware, is taking up the mantle for Natasha while she's on maternity leave. My name's Paul Chapman, and as been introduced, I'm the HEE's AHP Programme Manager, and we oversee and support return to practice from an AHP point of view. Next slide, please. Okay, so what is the programme? I think Natalie's given you a breakdown of what the programme is, but let's talk about where and how we've got to where we are at the moment. The HE runs a national programme, as has been explained. Our mandate is to deliver 250 HCPC registrants back to the HCPC register. It's linked in with the NHS People Plan, and it's a deliverable. But how did we get here? Back in 2016, I was employed as the return to practice lead for the East Midlands, and that was predominantly to deliver nursing. I came up with the idea of why can't we support our HCPC registrants? went along to my boss, who basically said, come up with a proposal, Paul, and I'm sure we can find a brown paper bag for you. I was lucky enough that in April 2016, I was able to start this programme of work, and it was very much to deliver return to practice for AHPs, healthcare scientists and practicing psychologists within the East Midlands. And as you can see, by August 2017, we'd actually got 38 returnees back onto the register, of which 85% of them were employed. This progressed to the point that we were actually approached by the government, by the Cabinet Office, who asked us to take our programme and make it part of a return to work programme that they were running as a result of a budget announcement. We were set a target, and that target was to return 300 individuals back to the register by March 2019. We were allowed to start the programme within August 2017. Although we missed our target, the actual programme was found to be of real benefit, to the point where Health Education England were encouraged to make it business as usual. Next slide, please. So, aim of the programme is to support organisations with workforce plans through returning former and current HCPC registrants back to the register. And what we mean by current is you might have an individual who has remained on the register but still lacks a lot of confidence or wants to get some updating of skills and knowledge. We can support those individuals. And a question posted before is, can we support EU residents who are HCPC registrants? Yes, we can. We could support former HCP registrants attempting to return to practice. It's a smoother pathway, and as Natalie described in the way that return to practice works, it's actually driven by the returnee themselves. We want to challenge those myths, and that's what this workshop is about today, this webinar, is to give you the idea at the end of the day, this is actually a simple process which, with a bit of support, we can get our returners back onto the register. We want to encourage NHS education and social care and HEI institutions to think proactively about return to practice. And more importantly, what we're doing today is sharing the learning across the network, across the system. Next slide, please. So, for a returnee, it can feel a long route to get to their ultimate aim, which is to return back to the register. As has been emphasised, these are qualified clinicians. They're just unable to use the protected title that they're entitled to. Therefore, the HCPC has created some guidance. The problem is we don't make it easy for them, because what we make them do is climb what is a mountain pass, and then we'll throw in a few roller coaster rides in the way by putting hurdles in. Next slide, please. What we found from the data that we've collected with the Return to Practice programme is that a majority of our returnees are female. That probably fits with the common theme because it's normally females that will take a break from practice. The average age of these individuals is around about 44 years. The oldest that we've got is 62, although we did have an inquiry from a 75-year-old, not heard from her since, and the youngest is 25. The average age is between 40 to 49 years old. Is that not an ideal opportunity to address workforce issues? The average number of years since they qualified is about 19, and the average number of years off of the register is about 8, although the longest is 30 years, and that individual is now back on the register. The average number of years since they last practiced is 9 years. That's not a long time away from practicing. 63% of those that have actually been off of the register will require a minimum of 60 days of updating. Very achievable. The average number of years clinical experience is around about 8 years. 8 years of clinical experience that we've spent time and money getting from that individual before they left. Most individuals were working at the old Senior 2 or Band 6 as we know it when they actually left. The average cost to return a HCPC registrant is £1,175. Compare that to £2,000 at the nurses. We've got a total of 2,056 years of experience has now been returned back to the register. And so far, Back in 2019 March, we had 277. So that equated to a cost of £3,025,475 spent on individuals. Let's think how much money we invested in those individuals when they were actually working. Next slide, please. Here we have some data on the number of returnees up to since August 2017. And as you can see, our bigger professions seem to have done really well out of it. Some of our smaller professions, our art therapists and our orthoptists, have also benefited from return to practice. Although I'm still a little bit sad that our prosthetists and orthotists are struggling to get any returners at the moment. Next slide, please. With this slide, what I've compared is the actual number of returners to the actual number of individuals that have signed up to return to practice. Now, what I would say is that some of these returners are actually still looking for support from a clinical supervised placement. Can you offer today? If your profession's on that list, which all of them should be, except for our P&O colleagues, hopefully that will change soon. Hopefully you can put your details in the chat or the question and answer section and put your names forward. We would love you to support these returnees. They are a value and an asset to our system. Next slide, please. What we've done here is we've broken it down by the regions, and what we've now got is we've got such rich data that we can actually break down the number of professions per region, which the regional leads will be using, and that will be sent out to the return to practice leads within the region to help support as well. And as you can see, the East Midlands and the South East seem to be the most popular places for return to practice. Be interesting to see if we could get the other regions to increase their numbers and get a nice even spread across this pie chart. Next slide, please. So, learning going forward, issues impacting on returners. One of the biggest issues, and our returners might talk about this later, is the difficulty they have in actually getting HR to engage with the process. And what that's actually done in some cases has actually led to our returners withdrawing from the process. The organisation, the service may be keen, but because there's not robust processes in place, this makes it difficult. What you will hear from our organisations that are presenting today is how they've overcome those hurdles. General understanding of the HCPC guidance, which we hope we've explained to you today. As we say, it's not about retraining, it's not about assessing competency, but it's about giving these people the opportunity to update their skills and knowledge. The maximum they need to do is 60 days. It's hard for them, we need to make it easier. They can treat patients, they're just qualified, they're just not registrants, so they can't use the protected title. Placement capacity, one of the things we always get pushed back on is student capacity. Well, you know, there's a lot of work that's gone on around increasing student capacity. That applies to our returnees as well. Use our returnees to help get support the capacity. There's, as I've said, they've got 8 years of clinical experience on average under their belt. Can that not be applied to use to support our students? Returners understanding, when do they start? That is a hard one because they sign up to the programme and then we get an email, when can I start? They start as soon as they can, and we want them to encourage them to start. As we said, we've got 24 months now to update their skills. Funding not being claimed by organisations, and we have plenty of examples of where these returnees have actually not had their funding paid to them. We've promised it, but it's not being claimed. We do realise there's an issue and we are looking into that. Next slide, please. So, what do former HCPC returners have to offer our patients? Need to link to the NHS People Plan. The People Plan is about increasing workforce. It's about making sure we've got the right people in the right place. Therefore, why aren't we taking returnees? These are fully qualified clinicians with a wealth of experience and knowledge, not only within a clinical environment, but life generally. And you're going to hear from some of our returners what they've actually been up to while they've been away. Support workforce organisational plans with recruitment issues. They're experienced, motivated clinicians living local. They're on your doorstep. Go out and find them. Why not fast track them to those difficult to fill posts? Your band 6, your band 7s that you've been struggling to fill. They can be brought in and they can actually take up that slack that you're finding. Raise the profile of your organisation to be the employer of choice. Try before you buy. Remember, it works two ways. They're checking you out as well. Reduce your recruitment costs, your agency costs, and increase your bank capacity. Next slide, please. We, within the programme, have had a mantra and a hashtag of I am ready to return, and hopefully today that we will see that a lot more on our social media campaigns. Within the website that you have been encouraged to visit, you will find tons of resources. You don't need to invent the wheel, it's been invented for you. And here we have some examples of the posts and the resources that are available to you. Next slide, please. On that resources are some case studies, but you'll also find our new videos of 4 returnees who've returned to practice during COVID, even dressed up in their PPE. Worth a visit, worth a watch, and there's some brilliant stories of how they've achieved what they've managed to achieve. Next slide, please. So, the secret of any success is being ready when your opportunity comes. The secret of my success was being ready and having the opportunity to drive this programme of work out, which I thank everybody for and the support you've given so far. But the secret of success for you as an organisation will be ready when a returnee comes knocking on your door looking to return to practice, and you will open your arms and say, please come in, we can make use of you. The secret of the success for a returnee is having an organisation that can actually support them to return to practice. Next slide, please. Here's my details. I'd like to thank you for listening. I'm now going to pass you over to the start of 2 organisations who've been really proactive in return to practice. And I'd like to pass you over to Jane Seagrave for University Hospitals Derby and Burton, who's supported a large number of return to practice AHPs. Thank you.
Hi everybody, and thank you Paul for introducing me. My name's Jane Seagrave. I'm one of the practice learning facilitators at the University Hospitals of Derby and Burton, and like Paul mentioned, we do have some experience of supporting returnees, so we're going to share some of that experience with you today. Next slide please. So the way I'd run through this today, I'm first of all going to have a little look at some of the challenges that we faced initially and some of the solutions that we came to overcome those, and then look at some of the benefits that we found from supporting return to practice, and share a few of our success stories with you as well. Next slide please. So challenges, both Natalie and Paul have touched on some of these already, and some of the big issues that we found that we have, people concerned around capacity. As we know, there's an increasing demand for placements and for learners in the workplace, and now with the restrictions around COVID, there's even more of a challenge there, and that's sometimes been a bit of a difficulty for clinicians to understand how maybe a returnee can fit in amongst all of that. Something I often got asked was kind of, well, how do we know that they're competent? There was this misconception that it was up to the supervisor, the clinician supporting the returnee to assess their competency, and like we've already mentioned, we're not here to do that. It's about supporting them gain that experience to get back onto the HCPC register. We're not here to assess them, it's about giving them that opportunity, and the returnee process is driven by the returnee. And in with that, kind of that general lack of knowledge around return to practice, people didn't really understand what it was about. And similarly, that we found that people were concerned about risks. They were very worried about, you know, what if they need a lot of support, or how long are they going to need, and is that going to impact on our student placements? Lots and lots of kind of unanswered questions, really. So we did a number of things to kind of address some of those concerns. And one thing that we do a lot of is kind of look at flexible options for return to practice. You've not got the restrictions in the same way that student placement does. So they don't have placement blocks and fixed dates. There can be a lot more flexibility on how many days a week they're going to do. They can be part-time, many can do weekends and work around family commitments, that kind of thing, or do shorter blocks. We've had returnees who've done kind of rotations and done experience in a variety of different teams within our trust, which I'll talk about a little bit later on. They also have real knowledge and experience that can actually help with the students. And if any of you have ever tried peer learning models where you take maybe more than one student at a time, having a returnee in the department can really add to that. They've got a lot that they can teach the students. A lot of educators will say to me that when they have a student, they're challenged in their own practice and their own clinical reasoning. The same can be said for a returnee. It's really going to help bring those skills back. Another thing that we did was develop a guidance booklet. People really missed having something tangible like you would have with a student. And the booklet that we developed sits somewhere between what you would expect for a third year student or a preceptee. It's very similar to our preceptorship paperwork, and that just gives a little bit of a framework and some guidance around structuring that supervised practice. So it enables them to assess any gaps in their learning and develop learning objectives, keeping supervision records and also signing off of hours. Our educators felt a little bit more assured that there was something to follow, that they weren't just kind of going in a little bit lost. And the other thing that we did, which was really, really key, we found, we actually set up a task and finish group. If we can just move on to the next slide, please. This was really important. One of the things that we found that there was difficulties getting HR engaged and getting contracts organised and meeting what clinical leads were wanting. So we found that, we went through round in circles a few times and eventually felt, let's get everybody into one room and get everybody engaged and on the same process. And by meeting regularly and addressing the tasks, we found that the process developed and it's actually really simple. There wasn't a need to overcomplicate it, and by all talking together, everybody was able to sort of reassure one another on the various processes that we could use. So it wasn't a complicated process at all, and absolutely helped. And we've continued that on, and those, it helps now when we're recruiting returnees. We have a group of people who are all up to speed and understand return to practice really, really well. So we no longer have those like bumps in the road. Can I have the next slide, please? What we did from there was develop 2 different routes, and this just gives us a little bit more flexibility to meet the needs of the department and the needs of the returnees. So our most popular route is our placement only route, which is also kind of a voluntary route. So this is just giving them their supervised practice, and this normally starts when we get an initial inquiry from a returnee and we ask them to complete a short application form just to find out a little bit more about their experience and what they're wanting to get out of the process. We can then kind of target specific areas of practice and look to find where our capacity is and sort of utilise that to find a placement for them. We bring them in to meet the team and the managers and ourselves for an informal interview to get to know them a little bit more. And if we're happy to proceed, we put them on a fixed term honorary contract. And again, the term of that contract is determined between us. It's often down to what the team can offer, but also what the returnees need in. So again, if the team can only offer, say, a month of updating, then we offer them a month. We normally look to around 6 months. We find that's enough for most, and some will complete in a shorter period of time than that. But we also then complete the occupational health screening, the DBS, and any of those clearances that need to happen. The employment route is really similar, the only difference being that we have an advert that goes out as a way of recruiting to that. And this is really useful if you've got vacancies that are difficult to fill, particularly at the band 5 level. So you can use that pot of money and employ them at a band 3 whilst they're doing, or band 4 if you'd prefer, whilst they're doing that updating period. And then they are invited to apply for the band 5 post once they've successfully re-registered. So that can be a really useful way if you are carrying vacancies that you're struggling to fill, as a way of kind of enticing in those returnees who may be looking. And it's another way of promoting that you support return to practice as well. If I can have the next slide, please. So the benefits then, we found that it is really beneficial. You know, it felt a little bit unknown to begin with, but we've had lots of success with this. Our recruitment from return to practice has been excellent. We find that most of our returnees do complete within 3 to 6 months, so really, really quickly. And we then have an experienced practitioner up and ready to work and to join the teams. Most of our returnees are local. They tend to look to local organisations where they would like to work when inquiring. So our retention is also really good. Of all those that have completed return to practice and gone on to long-term contracts, they're all still working within the organisation after completion. They've got the skills and knowledge to bring as well. They're already experienced and that works really, really well. They have a lot to bring, but also what have they done in their time away from practice? We've got some real broad skills that have brought in that have been very much transferable into their roles. And just to give you a couple of examples, we've had a recent returnee who was running a farming business with her husband, and she dealt with all of the behind the scenes recruitment and budgets and orders and all that kind of thing. So lots and lots of experience there. And we have another returnee who worked for St John's Ambulance, and she's a returning radiographer. So she's got additional clinical skills, and she's also had lots of experience in charity work and organising large scale charity events. So great communication skills, great contacts, and you know, an absolute asset to the department. If we can have the next slide, please. So just to share with you a couple of examples of some of the returnees that we've supported. We've had an OT start with us at the beginning of the year. She'd had a career break for about 10 years and having lived in France with her family, and then returned to the UK and was keen to complete her return to practice in a very short period of time after her husband was made redundant. So because of placement capacity, we were able to get her kind of a rotation across some of our neuro teams. She worked across about 4 different teams, doing 2 or 3 weeks in each to gain a really good breadth of experience across our neuro speciality. And she is now employed as the static band 5 on the stroke unit. We also have a diagnostic radiographer who was out of practice for around 8 years, and she did her return to practice part-time over 6 months. And during COVID, she started at the end of March, and she actually got her registration back last week, so is really, really pleased with that. And she's joined our flexible staffing bank as well. She also has an offer of a post in CT starting in January, so that's really, really exciting news for her. We have another diagnostic radiographer who was 25 years out of practice and updated in just 4 months, worked so hard to get through it. And again, through the peak of COVID, she came back and again works on our flexible staffing at the moment. She's just looking for the right post to come along in an area that she's interested in. But I would say the length of time out of practice was not an issue at all. You know, she's really taken to it. It's like she's not been away. And our physio, again, we've got a physio there who was just over 7 years out, again, updated in a really short time, and now works as a static 5 in our women's health team. And she's been with us back on the register now for about a year. So that's excellent. The next slide, please. And just finally, there's a couple of quotes here from some of our returnees, and just shows how much their confidence has improved and how it really makes a difference to them to be able to step back into that profession that they are passionate about. And so that's just really lovely to see some of the positive feedback that we've had. And like I say, all of our successful returnees now work for the organisation. So from a recruitment perspective, it's absolutely fantastic. Can I have the last slide, please? Okay, so we're going to just pass you on now to another colleague of mine, Debbie, who's going to talk about the return to practice experiences that she's had. But I'd just like to say, if anyone wants to ask any questions, my contact details are on the beginning of the slides there. So thank you ever so much for your time. I'll pass you over to Debbie. Thank you.
Hi, so thank you. Thanks for that, Jane. Actually, it's really interesting because I've got quite a few things that will cross over. So hopefully will help you to think about how you might be able to deliver return to practice where you are. So my name's Debbie Andrew. I'm an occupational therapist by background, and I work in the learning and organisational development team at Cambridge and Peterborough. So what I plan to do, we're running a little bit behind, but hopefully we'll be okay for time. My plan is that I'll just take you through our journey with return to practice. Our method and approach to how we've actually delivered that in our trust. I've got a slide on our results and some thoughts about our evaluation, really, about how the process has been for us, thinking about our next steps, and also I'm hopeful I'll be able to leave you with some top tips at the end. So next slide, please. Okay, so Paul very kindly came to speak to us at Cambridge and Peterborough to talk through the national programme at HEE for return to practice, and we kind of felt that it fitted really well with our organisation, and we felt that we've got some geographical challenges, and I'm sure each area has kind of got its own particular challenges about how they might be able to maintain the workforce. So we felt that return to practice was a good idea for us. We had a couple of early inquiries about return to practice, and I've put there it's a bit of a slow burn really, but it was people contacting friends of friends or people that were aware of staff that worked in the organisation, and they kind of said, well, you know, I would like to return to practice, I don't know what to do, can you help? So I think a combination of the national programme and those kind of connections started the process off for us really. We did have some inquiries that came through our trust website and into our sort of AHP leadership, and I think as the programme gained a bit more momentum, a decision was taken to centralise the process for us, and that really helped us to develop a more centralised system, if you like. So it just meant that inquiries were going to one point of contact, which we found was much easier, and hopefully the experience for the returnee was a much more positive. So developing that robust system was really helpful for us. The other thing to say is the early successes that we had really helped to generate further return to practice opportunities. So making sure that using those case examples was really helpful for us. And as part of the journey now, we're looking forward to how we can build on our success. So next slide, please. So the return to practice sits with me now in the learning and organisational development team, and it sits really well with my other work streams. So I'm the AHP lead for practice education, so I look after the pre-reg AHP students, work on the preceptorship programme and apprenticeships for AHPs as well. So it's a kind of natural good fit really. And what that enabled me to do was to look at developing a process, look at that robust governance system and support that the returnees needed, and that the teams hosting and supporting returnees needed too. So that really kind of helped me to take the learning from my other work streams and plough it into the return to practice. Again, you put a theme coming through here, but the use of the case studies was really one of the most useful things that I was able to do, because it really did generate extra placement opportunities. So being able to say to people, look, this actually works, this is how it can work in practice. You know, it's great, and Paul was very enthusiastic and inspired us, but actually what does it look like delivered out there in practice? And it was really much easier than we thought once we navigated through the kind of HR and process system. So I think one of the things that we've noticed, and I know that Jane talked about 2 routes, I think we've got to a point now where I feel like we've had lots of different routes in, primarily honorary contracts. More latterly, we've had an increase in people coming through return to practice via recruitment route. So we had actually had an interesting conversation just only last week where there was an interview for Band 6 post, and they've appointed, subject to HCPC registration, somebody needing to do the return to practice because they were the best fit for the job. And I think that creative thinking is really helpful. So I think the work that we did over the summer holiday as well with the students, the paid placements for students during the COVID response was really helpful, because it made me think about using fixed term contracts and using our temporary staffing services as well as other routes. So we've got lots of different opportunities available to people. Next slide, please. Thank you. So this slide just shows you some of our results. So essentially this top one was about placement inquiries and the placements provided. But what's really interesting on this slide for me is that we've recruited, so we've offered, so if we take occupational therapy, we've had 5 that been offered programmes and placements, and 4 we've recruited. 1 actually has a post in East of England but outside of our trust, so still in our area, which is great news. But what's even more powerful is that these have still got substantive roles in 2020, and our first one that we got back on the register was I think early 2018, so a couple of years on, and we've still got those people in post. So not only is return to practice a good recruitment tool, I would really suggest that it's a good retention tool too. Okay, so next slide please. And just, yeah, that's it, thank you. So it's not without its challenges. I was front loaded a lot of time and effort, and hopefully these kind of events will help you to think about sharing best practice and learning from other people's experience, so you can hopefully cut out some of that time. Having the effective system in place made it a lot simpler. Once we were up and running, that made it a lot easier. Flexibility was really important, and Jane spoke about this, and hopefully some of the returnees will do too. It's great to have a system in place, but listening to what that returnee needs in terms of their updating skills and knowledge is really important, and also what the teams are able to offer. I will say there's a significant adjustment to be made, and it's not to be underestimated. So there may be some work that needs to happen before a placement's offered, and that might be something that the returnees would like to discuss later, or I can certainly give you some of my reflections on that. And for us, from my point of view, the return for practice has been really successful because of the time and support that I've received from our trust AHP leads. Having that kind of support behind and saying, yes, actually, this is something we want to work with, has been really helpful. So next slide, please. So next steps, I'll just whiz through this. Basically, what I'm doing at the moment is scoping out which of the different routes that we've experienced so far, which works best where, and just developing some sort of pathway of options available to teams and to returnees so that we can make the best fit. Jane talked about preceptorship programme, and we certainly found that using our preceptorship paperwork has been really helpful to give people a framework to pin the return to practice on, because I think people are kind of familiar with that sort of, what skill set do you need? And so people are managing expectations. Certainly looking at developing placement opportunities across the system, so outside of our own organisation, using the AHP Council and thinking about that individual returnee, what do they need? Not what we're able to offer necessarily, but where else can they get that from? And maintaining the links with HEE is absolutely crucial for us, and it's been brilliant. So next slide, please. So top tips, here we are. Really, for me, the main thing is having a single point of contact in the organisation. So from the returnees' point of view, they're not in the early days, I had lots of strings of emails saying I'm trying to find somebody to support me with this. Having a process and a single point of access really does help the returnees' experience, and it can make it a lot quicker. Having the flexibility within a framework, so responding to I can only work part-time because I've got to drop the kids off and I'm not quite sure what it's going to feel like going back into work, has been really important. We could have lost a few people if I hadn't said, well, OK, let's just give it a try and see how you go. Then I had a phone call 2 weeks after that initial sort of small amount of hours saying it's going great, I love it, can I do more? And we've got that person in a substantive band 6 post, which is just speaks volumes. So there we are. I've just shared you another best practice case study thing. So the other thing I'd say is also preparatory steps for placement. So one of the barriers that I feel, or one of the places where people sometimes have struggled, is where they've not been able to appreciate the challenges of how patient electronic records may not have been around when they were last in practice, or the whole leaving children at childcare and going back into that, stepping into that workplace. So perhaps some work as a therapy support worker or some other work experience to kind of navigate and practice those skills before they really consider about their skills and knowledge might be worthwhile. I don't know, I'd be interested to hear from the returnees about that. And again, finally, making sure you keep your networks, linking with people. I'm more than happy to answer any questions, and I'm sure Jane is as well, but see what works well for other people, and see, does that fit with your organisation? That's, next slide please. That's it. So there's my contact details. The only thing to say really is return to practice is an excellent recruitment and retention tool, and long may it continue. Thank you.
Brilliant. Thank you so much, Jane and Debbie. That's such a fantastic overview of your experiences, and also moves us brilliantly into our returnee panel. Now, I know that some of our panel, I think, have had some technical problems, so haven't been able to get on with us, unfortunately, but I do think they and a number of others are part of the audience and are posting some comments in the chat box. So I'd very much like to welcome our panel today, and I'm going to hand over to them to introduce themselves. So welcome Juliet, Sandra and Avril.
Hi, thank you.
Hello. Hi.
So what I'm going to ask our returnee panel to do is, first of all, introduce themselves briefly in terms of their role and how long they've returned to practice and where they returned from. And then we've got some questions to ask them as a panel. And please do pop any questions that you might have in the audience for them in the chat bar. So over to you, Juliet, to start.
Okay, welcome everyone. I hope you can hear me okay. My name's Juliet Illingsworth. I'm currently working as a Band 5 physiotherapist with Leeds Community Healthcare Trust, and I'm actually loving it. My story is quite a positive one. I just want to give you a little bit of background. I was offered a placement more or less straight away on approaching the clinical lead for the trust. And that really started the ball rolling for my return to practice. Just a quick summary, I trained in 1990 and qualified in 1993 in Leeds and worked as a junior, as they were then, senior 2 physio, and then got a senior 1 post in Barnsley and worked for a GP practice and community. And I worked for 9 years. And then, because it had been something I always wanted to do, I packed all that in and joined South Yorkshire Police and worked, as you can imagine, on shift. I worked in CID, I passed my sergeant's exam, and then ended up in serious and organised crime and worked there for 19 years. And prior to retiring, I did look at return to practice, and I just thought, I thought it was impossible. I didn't know where to go. I didn't know who to approach, so I shelved it initially, and then 9 months prior to retiring I looked again, and that's when I approached the trust and was immediately offered help and support. They then set the ball rolling for my clinical placement, and while that was all being organised, I then did 30 days self-study because I had to do 60 days of updating. And that was doing podcasts to and from work. Basically took over my life for 7 months. I did studying at weekends and evenings while still working full time. I did 10 days of formal courses, which I took annual leave to do and self-funded. And then by the time I'd done all that, I was ready for retiring. I retired on the Friday and then started my clinical placement in Leeds Community and did 20 days on an honorary contract. Absolutely loved it. Was a little bit worried about the knowledge, but it soon came flooding back. And because I'd done a period of updating, all my anatomy and physiology and everything else that I needed to put in place with the supervised placement came to the fore. It took me 7 months from start to finish to get back on the register. Started in March 2019 and then got back on the register in October 2019. Because I had such a positive experience with the Leeds Community Healthcare Trust, I applied for a band 5 and started in January this year. I've done 8 months already, but because I've got, I feel, quite a lot of carryover skills, I'm already looking for a band 6 post. If I can just leave you with, some of them have been mentioned already, but some positive notes for Trust to have a think about, that we are already qualified. I know Paul's already said this. We will have to do a lot of updating, so our CPD will be really, really up to the fore, and I did loads of research and looking at articles. We've got a massive amount of carryover skills. I've got 29 years of dealing with members of the public and people, and other people have come from retail, hospitality, they've been parents, but it's all life experience that they bring to the role. And the last thing I would say, because it's hard work and you're having to, a lot of us are having to do it while we're working, we want to do a good job, but we're really motivated. So you will, if you give us your support, you're more than likely going to end up with us working for your trust. So it's a win-win on both sides. Thank you.
Brilliant. Thanks so much, Juliet. Sandra, over to you.
Thank you. It's good to be here. Slightly nerve-wracking. My name's Sandra Roper. I, like Julia, I actually qualified in 1993 as a physiotherapist. I worked for about 7 years and then gave up my registration for building a family. And now that the children are through university, I'm looking to come back into physiotherapy within that time. I've got a decade experience of running a family business. So lots of recruitment, training, working with people of all different backgrounds, doing a lot of shared decision making with them, motivating people. And then I've just completed 6 years running an operations division for a local charity. So a lot of stuff around procedures, policies, project management, leading volunteer staff, training people, mentorship, coaching, that kind of thing. So quite a few different skills whilst being out of physiotherapy. I started my return to practice thoughts actually 2 years ago. I went to the conference, the East of England CSP, that's our professional body, and there one of the questions that I brought up in the Q&A was, I just don't seem to be able to find any information about how I get back into physiotherapy. It feels like a big leap for me, but I don't feel like anybody knows how to help me make that leap. And so I ended up so lots of people actually coming to me within that who were practicing physio saying, hey, you know, like, we'd love to give it a go, we don't know what to do. And from that I ended up having a volunteer week. I took a week of annual leave and spent some time working in a hospice in Bury St Edmunds, and it was amazing, and it showed me that actually the skills that I've got, both my passion for physiotherapy and the skills that I had built through the other years, they all just melt together in order to be a total advocate for the patient and for working with other healthcare professions to get the best for the patient. And it just came back completely naturally. Because I'd been out for quite a long time, I was one of the people that had to do 60 days of practice. At the time, that was within the 12-month time scale. And that 420 hours feels like a massive leap, even though you know that it is totally necessary, because you yourself know that you just haven't practiced in physio for a while. So even though you know it will come back, you know, things change, things move on, and you want to be competent for the patient. You want to have the right skills. You want to have great signposting, awareness and knowledge for the benefit of the, you know, like for the organisation, but ultimately for the patient. So you end up being very, very motivated to get it right. And I think there's some concerns even in the Q&A section here about, you know, like, how do we know you're competent, and the risk management of it. And I would kind of echo that from the returnees' point of view. We're super aware that we haven't done this for a while, and even though we bring lots of skills with us, we're aware that we need help too, to make sure it's right, because everything about us, you know, like, we wouldn't be returning into a profession without being totally passionate about it and what it stands for and what it brings and how it can lift people from the situation that they're in to where they want to be on their sort of rehab or whatever journey. So I would say we echo those, and that's why we're so motivated to get in. Back in to the register and back into work. It is a real challenge. It's you know, like, you come with skills of what you've got, but when you're looking at my personal journey, as my current work won't enable me to fit in as much as I want my updating of skills hours, so I've had to hand in my notice in order to try and go for the clinical placement, in order to get onto the register, in order to then apply. And that's a lot of time potentially without income. So you've got a dedicated set of people as a returnees that want to do this well, and they really, you know, like, will be your greatest advocate. I would say they will be the you know, like, we're motivated to learn and to listen, and quick to learn just through the life experience that we've already had out of the profession. So I think that's kind of where I would say, actually, it is a scary journey. I think it's a scary journey for people providing placements, and it's a scary journey for people who are asking for those. But actually, just to be in the room with other people and say, you know, like, what are the difficulties? This is just a fantastic opportunity to have this moment of awareness happening right now, because I think for me, the biggest obstacle that I have found is people just don't know what to do. And it's not that people aren't willing, but people don't know what the next step is and where to go. And, you know, it is a slow burn, and none of us want it to be. Once your heart is lit for returning into your profession, you just want to get there as soon as possible, and be as great as possible for everything that you know that you can be in that profession. So yeah, it's an exciting journey, and I would say, you know, like, anything that can make it easier and help with the workforce supply. You know, like, we're experienced in our profession, we're experienced in life, and dealing with people, especially in a COVID time where there's more doubt and concern for people. Actually, you've got a set of return to practice people who have already done that journey as well, and can really input into a work setting. It's not like we're students. We know what we're doing. We just haven't done it for a while. And, you know, we're ready. We're ready to come back.
Brilliant. Thanks so much, Sandra. Avril, over to you now.
Hello, my name's Avril Lowe, and I'm a diagnostic radiographer. So it's quite I qualified in 1984, so there's been a few changes around. I did spend 3 years as a general radiographer, and I did spend another 3 years after that as a cardiac radiographer. But after that, I moved into industry. So if we look at how long it was since I last x-rayed a patient, that gap between me x-raying somebody's chest and me re-x-raying somebody's chest, that 30 years, that's me. What was me? But it was like riding a bike, really, it was like riding a bike. So how did I get here? So because I'd spent 20 years in industry, I was working with x-ray systems. So although there's been massive changes in technology, I did actually keep up with those. So for me, the big change wasn't the technology, but there were other massive changes that I had to re-catch up with. So I took 60 days to return to practice, and I was so keen to return to practice that I came all the way from Portugal to do it. So that was last summer. So I spent, well, I say 20 days doing my CPD as private study and formal study. In fact, it was a lot more than that when you add it all up. And then I spent 2 months in clinical placement, so relearning my practical skills of x-raying people. So I would say, where was I going? So what I'm doing now is, so after returning to clinical practice in September, unfortunately my timing was not perfect because that all the students that had passed through the hospital at the time were being hired at that point. So I became a bank radiographer. So I spent time relearning my skills in various ways. So I've been in general, I've been in cardiology, I've been in theatre, I've been in 3 different hospitals. And I thought to myself, where's my niche? Where's my niche? And so after that year I've spent of doing my practical radiography, finally I'm doing what I originally did when I first left my HCP registration behind, when I first kind of stopped being a clinical radiographer, which is teaching. So if we look at, I've had my time in industry was mainly teaching, but there was also marketing, there was product development, there was research. So I can bring all that back now, because what I started last month is I'm now back in teaching and I work at the University of Plymouth as a lecturer. So all those skills I hopefully can then share with all the students, all that those other skills that I can actually bring to their experience as well.
That's fantastic. Thanks, Avril. And thank you all, because that really brings to life the rich experience and inspiration I think you're bringing to service and to this session. So thanks again. Now I've got a couple of quick questions for you, and then we're going to go to the chat bar for questions for yourselves and for the wider panel. So it's really exciting to see lots of offers of support from NHS trusts and employers in the chat bar. So I was going to ask you 3, what would be your top tip for potential employers and placements? Juliet, should I go to you first? I can see your hand up.
Yeah, I was going to say, I think having someone within the trust that has a background about the process would be great, and somebody having an understanding of what's required, because I attached the HCPC guidance with my email when I initially contacted the trust. But I think having somebody with that knowledge would be great, and I think giving Paul set up a Facebook group that has been absolutely phenomenal for me, because people were answering my questions. Now I'm helping others with the same process. It would be great if trusts could have that same level of understanding, so that they could then pass that on to anybody who inquires. Because although the HE have obviously this bank of people return to practice, I'm sure there'll be loads and loads of people out there that do want to return to practice but aren't part of that group. So it would be great if they did approach a trust, that they came back with, like I did, I suppose, a positive attitude, but also having a knowledge of the process. That would be great.
Great, thanks, Juliet. How about you, Sandra?
Yeah, I think I'd echo that as well. I think some of it is like when Debbie was talking about that single point of contact, that's really helpful, because a lot of the time when you're inquiring of help, you just don't know where to go, and the person that you go to doesn't know where to go. So that would be great. But I would also say, from an employer point of view, start putting it in the job adverts. If you're open to return to practice, then when you're advertising, having it just in there, it enables people to search for it. It enables us to find out, oh, they're willing to take me on potentially, and that's really helpful as well. So including it in the advertisements, you know, like get HR on board as well, and just make it known that it becomes a thing. I think it's a term that's just not understood or known, and so if we make it more obvious, if you can make it more obvious, then you will find us and we will find you much better.
Brilliant, thanks, Sandra. Any tips from you, Avril?
Absolutely agree with those. Single point of contact would have been so much easier back then. I mean, I know it's not that long ago, but I was doing everything by email, and I'm sure it's the same now with people who can't go and visit the places as they might before because of COVID. I was doing it by email because I was abroad and trying to find a placement and trying to persuade people, yes, I am worth it, I am worth it. Because we're keen to go through all this. We're keen, absolutely keen. And there's something else I was going to say that it'll come back to me in a minute.
Thanks, Avril. So I'm just going to move to some of the questions for the wider panel. Just to flag in the chat box, there's been lots of offers of support for returnees, which is absolutely fabulous. Thank you everyone who's posted your email address for us to get in contact. There's also lots of questions in the chat box, and just to say that Paul and Natalie have been going through some of those and posting replies, and will continue to do so because I think we're starting to run out of time. But Paul, I've got a quick question just to pull out for you because it's come up a couple of times in the chat boxes. How do trusts access the funding from the national programme that you mentioned? Right.
The national funding that we've mentioned is accessible by the trust sending an invoice to the HEE contact details that we can provide. We do have a process. It's done via the invoice process. Once they're registered on the system, which most organisations are, that money is then paid back to the organisation, and we ask the organisation to share the £500 with the returnee. We do not need to see receipts. It's a one-off payment to allow them to support. Still not sufficient, still not enough. We're very aware of that. But unfortunately, what doesn't happen is sometimes the organisations don't claim the money in a speedy time. So it's about invoicing HEE, but we do have some guidance. I will say that we are actually reviewing that guidance because we consider it's not working as efficiently as it could do.
Great, thanks, Paul. I'm conscious of time, so I've got one more question, and that's around countersigning. So if there's a question about returnees and HCPC numbers, do they require countersigning in patient documentation, Paul?
Right, okay. They don't require countersigning. It's not a mandatory requirement, but it's a good way of actually providing assurance. What we do is we advise that all the returnees sign it with their name, and then they put return to practice and then the profession after it. We would advise that anybody who's supervising that individual would undertake a period of time with that just to check notes and things like that. But there is no mandatory requirement to countersign the signature at the end of the day, as long as you've put the title return to practice practitioner or return to practice physio, OT, speech and language therapist, etc.
That's great, Paul. And one more question that's just come up in the chat box, which is a really relevant one for wider programmes of work, is can assistant and support staff be involved in supporting return to practice hours?
Yes, there is no reason why they shouldn't. The term supervised practice, and I think our organisations have covered this, it is very wide. It is to the fact where you can be standing over the individual, but it's all to the point of where you can actually be managing them at arm's length. And a question I saw earlier was, can these individuals in a community take a caseload? Yes, they can. At the end of the day, they are qualified clinicians, they're just not registered. We allow our support worker workforce to go out and see patients unsupervised by registrants. They're delegated the task. So just look at it about delegating them a workload, a caseload. But obviously you would do that after a period of support and that going forward. But again, I think as we've seen from our returnees today, they've got a wealth of experience, and the thing they lack is not competence, it's more confidence, and it's about building their confidence and encouraging them to work in the areas that they want to work. Hopefully that answers the question.
That's brilliant, thanks, Paul. And just to mention again that there's a number of questions in the chat box that colleagues have responded to, so that there's a wealth of answers and information in the chat box. I appreciate some people aren't able to access this, I think, so we will make sure we support that with information following the event. So so we've got just a couple of things to cover before we finish, and I'm going to make sure we finish on time. So Megan, if you could pop the next slide on. So we've pulled together some suggested next steps for systems and organisations, and obviously these build on the tips that you've heard from our returnees and the experience from the two trusts that have presented. But just some things to think about in terms of actions going forward. So first of all, think about planning in terms of prioritising professions, perhaps setting some targets for AHP return to practice, either as a system, an AHP faculty, or as an organisation. Really prepare. You've heard lots of brilliant examples of how to prepare, but really maximising that organisational readiness, processes, single points of contact, and also really crucially culture. So a culture that absolutely embraces and supports returners. Also engage. It's really crucial to engage across your organisation and across the system. So ensuring that you've got support from stakeholders across your organisation, including HR, professional leads, staff, assistant and support workforce, and many, many others. Also promote. So we'll post the link again to the website, but there's some really, really great resources to help you to promote return to practice within your area. You don't need to reinvent the wheel on this. There's lots of resources out there, including images, social media images, videos, and much more. So again, we'll post the link at the end of the session. And then last but by no means least, connect all your return to practice to the National HE programme to absolutely maximise success and fundamentally maximise a really great experience for people coming back to practice. Next slide, please, Megan. So we've just got a couple of minutes back to Menti. I can see some people have been responding, but we've got 2 questions for you. The first we're going to ask you is what you're going to do as a result of the session today. So I'm just going to give you a minute or two to log on to www.menti.com, pop in the code 984845, and give us some suggestions about what you're going to do as a result of this webinar. What action are you going to take? We'd really love to hear from you and to hopefully see that we've helped make a difference to your plans going forward. Any problems accessing Menti, please do pop any comments or suggestions in the chat box. I'm going to, in a minute, there's one more question to ask you on Menti, but I won't move it forward until you've responded to this one. So I can see 18 people have responded so far. There's a few more of you on the session, so any feedback would be absolutely brilliant. Next slide, please, Megan. So just for the last couple of minutes, I just wanted to say a huge thank you. I wanted to say a huge thank you to our returners. So to Juliet, Sandra and Avril for joining us and supporting the session and giving you such important insights and feedback. And also for other returners who've been in the chat box posting questions and suggestions. Thank you all. I want to say thank you to all of our speakers for such brilliant insights from NHS trusts. Really, really valued. Thanks, Debbie. Thank you. And Paul and Jane Gardner-Florence, thank you both, because this wouldn't have happened without you. This started as a regional webinar and rapidly turned into something national, so it wouldn't have happened without you both. And lastly, thanks for everyone for joining the session. We really value the time and support for return to practice and for making this happen. So I'm just going to move on to the next Menti question. If Megan, if you could just go back, it's like that's it, just to remind you of the code if you need it. And we've got one more question, which may look familiar. I'll just give you a couple more minutes to answer that before we finish the session. Paul, I don't know if you've got any closing comments while people are just filling that in.
I'm alive.
You are, sorry.
Yeah, no, that's fine. Okay. I'd just like to thank everybody for their time today. Those that know me know that I'm really passionate about this, and for me this is about the returnees that have supported us every day, and they know on the Facebook page I will respond to their answers. If I don't know the answer, I'll go away and find it. But for me it's more about realizing the potential these individuals have got, and I realize from some of the questions there are difficulties related to individual professions, but at the end of the day, if you take the concept and you take the idea that these individuals can add value to your service, you can work through those issues, and 2 organisations have proved that to their benefit. So for me it's about saying a big thank you to the returnees that have agreed to return back to practice. Thank you to all those organisations that have supported us so far. I'd also like to thank Health Education England, because without them helping me to achieve what we've achieved today, I don't think we'd have a programme that is actually going to hopefully take off after this webinar. So thank you very much. And Naomi, thank you very much for your chairing. Really appreciate it. Okay, thank you.
Great. And I know Jane and Debbie have both offered support to other people, and I think they've popped their email addresses both in the slides and in the chat box. So I think we'll leave the Menti open for a couple more minutes, but we'll bring the session to a close. Welcome any feedback or suggestions in the chat box, and hope you enjoy the rest of the day. Thanks everyone. Bye bye.